He seems as active as any lad of his age, but 13-year-old Connor Collins used to be unstable on his feet. He's one of the success stories of Postural Care, a community interest company or not-for-profit organisation aiming to change the lives of people with a range of body shape problems.
Hey Connor, you enjoy that bike ride?
Yeah, it's good.
Well, Connor was diagnosed at 17 months with cerebral palsy, and we were painted a very dark picture at that time. She said that Connor would never be able to kick a football, wouldn't be able to ride a bike, probably wouldn't be able to swim. There were obviously going to be difficulties with his walking. He would end up having to wear splints and generally given a really, really grim picture.
How are you getting on then, Connor?
Good, thanks.
Good.
With 25 years' experience as a family-run concern, Postural Care advises that people who find it hard to move are at risk of body shape distortion. It believes a patient can be most effectively helped at home with therapeutic positioning, which gently supports them in bed to prevent stresses on joints and even restore body shape. Traditionally, this form of therapy has been used to support those with more complex healthcare needs than Connor, but the company says the benefits for patients like him are only just beginning to be understood.
So what you'll do each night is just stand at the foot of the bed and look up Connor's body, and you'd like his knees to point to the ceiling. You just need to check that his pelvis, the two bony bits here, are nice and straight.
Body shape distortion has the potential to limit life, and it's important that we recognise the destructive nature of those forces at night time. By understanding how and why the body changes shape, we give families a chance to protect their children and to protect them from some of the secondary complications associated with those changes.
Because we've managed to straighten him up in bed, it's had a positive impact, and Connor can walk properly, he stands tall, and the problems that we had with him falling over have disappeared. Connor can actively take part in sports at school. The PE teachers recently said to me, which was fantastic, that he knows that Connor's got cerebral palsy, it's written on a piece of paper, but in actual fact, in essence, there is no difference because Connor partakes in all the sports. He does really well at sports.
When I go to bed, it feels really comfortable and it's easy and quick to set up.
Connor's asthma has improved. He's more independent and has fewer medical appointments. His condition no longer dominates life for him and his family. Using methods which it explains are in line with NHS QIP standards, Postural Care records body symmetry using Goldsmith indices measurements as evidence of a patient's progress. It's teamed up with another community interest company, Simple Stuff Works, which provides its equipment.
As an organisation, we provide training for families, healthcare professionals, care staff, personal assistants, people who are really within an individual's first circle of support. And we provide accredited training through the Open College Network.
We have contact from a number of families across the UK and across the world, and we know of large numbers of children who have avoided surgery, which is huge in terms of cost to the system, but also in terms of cost to the family.
Postural Care, CIC, is working with Skills for Health and 8 primary care trusts across England to deliver training in an area of therapy which, in its view, is often overlooked, but one which it says helps youngsters like Connor make the most of life.